So how is hypertension managed in the people like you called CKD, and what medications are commonly used in circumstances like these?
Okay. So hypertension in layman's terms means high blood pressure. Your blood pressure is very high, and that's called hypertension. And hypertension is the second most common cause for developing chronic kidney disease, diabetes being the number one worldwide, and hypertension is the second most common cause. And 1 in 5 patients who have hypertension can develop chronic kidney disease. 1 in 3 diabetic patients can develop chronic kidney disease. So hypertension, when there's very high blood pressure within your blood vessels, it affects your body from head to toe, including your kidneys. So there's a lot of pressure in the blood vessels that builds up. And what happens is it stiffens the arteries, it constricts the blood vessels, it narrows the blood vessels. So as a result, what happens is when your blood vessels are narrowed, the amount of blood that goes into your kidneys, because remember, your kidney is purifying your blood of all the toxins every second, every minute of the day. So the amount of blood that flows through your kidney is how much your blood gets purified. So if your arteries and your blood vessels are stiffened, then there's less blood flowing through your kidneys to get purified. So what happens is the toxins get built up, and then the fluid gets built up because the kidney helps to eliminate toxins and excess fluid. So when those two things get hampered, then the waste products get built up, the fluid gets built up. That in turn causes more pressure within the blood vessels. That raises your blood pressure further. So it's kind of a vicious cycle, and there's sort of a downward, spiraling from there. So in patients with chronic kidney disease, the mechanisms that are involved in in developing hypertension are, it's usually sodium retention, salt retention, because the kidney is the main organ that excretes salt out of your body. So if you are not able to excrete that salt out effectively, then the salt gets retained, and that thereby, when you retain salt, it actually attracts fluid, it attracts water. It does not let the water go out. So that, when the salt and water build up, that raises your blood pressure. It also, there's another way that blood pressure is manifested in chronic kidney patients. The kidney, because it's scarred, it's not working 100%, it starts producing certain hormones, and that's called renin and angiotensin system. It gets upregulated, and it produces a lot of the abnormal hormones that raises your blood pressure as well. So as a result, when we treat patients with CKD with medications, we're taking into consideration all these factors and then choosing the appropriate medications based on the individual. What is it that the individual is coming with? Like, let's say a patient with CKD comes to see me. And then the most important thing is 3 things that I always look for in the patient, pay a very close attention is, we take a very good history of the patient. What are you eating? What is your diet consist of? Is this patient eating mostly processed food? Is this patient eating mostly outside food all the time? They're eating less home cooked meals, but rather eating a lot of processed food, fried food, salty food. And then I examine the patient. When I examine the patient, I see, I'm looking for, is there any fluid retention? And fluid retention is usually on exam, it is evidenced as swelling in your legs or swelling in your, in any part of your body, wherever there's loose tissue, or your weight has gone up. If the patient says, oh, I'm rapidly gaining weight, then that is sort of an indication that maybe they're retaining fluid. And then the other thing I look at is the blood test and the urine test. Is the urine has a lot of protein in the urine, or if there's a level called a creatinine on your blood test that's getting worse. So all these things, I look at it. And then what I choose, the medications that I choose for this patient will be, I usually start with 2 medications, maybe a water pill, which is called a diuretic. A diuretic, what the kidney is unable to do because it's failing, that diuretic or the water pill will help the kidney by eliminating the salt and thereby pull the water out. And that restores, the normal fluid balance in your body, thereby bringing the blood pressure down. And the other medication that I would use for these patients are called ACE inhibitors which is the full form is angiotensin converting enzyme inhibitors, or ARBs. So these two medications, these classes of medicines are specifically important because they decrease the blood pressure within the kidney, not only systemically, but within the kidney itself, and they help to decrease the protein spillage. So this patient coming in with protein in the urine and a lot of fluid retention, when a combination of these medicines are given, that will help to decrease your blood pressure in a better way than just choosing one medicine. So that's why in patients with chronic kidney disease, when it involves multiple medications from different classes of antihypertensives. So it's not just one size fits all kind of a medicine, and one medicine will work better for one patient, and that may not work better for the other one. So it's a combination of medications include we choose based on the history, the lab data, and the exam.